Are eye doctors lying or deceiving patients about LASIK outcomes? I get this comment or messages from people about this more than I thought that I would, saying, hey, I did LASIK and I swear my eye doctor didn't tell me about these possible side effects, or at least how bad they could be, and now I'm just left out to dry dealing with these side effects. This can be a very sensitive topic, very sensitive video that I'm kind of nervous to make, but I wanted to at least go into the data, the possible side effects, what people are experiencing, or at least be an advocate for those people that feel unheard, or a way for us eye doctors to help educate or provide more information for our patients that are trying to decide whether they want to do LASIK or not. Now, a common thing that a lot of doctors say, including me, is that LASIK does have a very high satisfaction rate, 95% plus satisfaction rate, which is amazing. In fact, it's really great when you compare it to other surgical statistics. And because it's so high, sometimes we drop the ball mentioning the possible side effects or including that small percentage of people that do suffer from side effects. So we have to remember, satisfaction does not mean no side effects. And some of these side effects can be serious. In fact, this became such an issue that the FDA came out with a new guideline law called the Patient Decision Checklist to provide information and education to patients that are considering doing LASIK. And it received some criticism from the American Academy of Ophthalmology saying, hey, this is just gonna unnecessarily scare patients into getting LASIK because it's such a high percentage satisfaction rate. And so there's kind of a little bit of back and forth, but now patients do need to be provided with this patient decision checklist, including all the possible side effects. Now let's talk about some of these side effects that we are mentioning. The number one most common kind of secret side effect is dry eyes. This is well known and probably the most common side effect that people experience. In fact, up to 95% of the people that have LASIK will have dryness right after surgery. And this does gradually get better. And the reason why this happens is when you have LASIK, laser cuts into the corneal tissue and damages the corneal nerves. The corneal nerves is what regulates your tears. It gives feedback to the brain to tell you, hey, you need more tears, your eyes are dry. And when that's damaged, yeah, the eyes end up being dry. Now, luckily, as time goes on, those nerves do improve and that feedback loop does improve, and so dryness does get better. Now, did you see what I just did there? I probably made the most common mistake that doctors make talking about, yeah, for the majority of people, 95% of the people will experience dryness, but it'll get better. But that's not for everybody. Now, this next part is maybe what gets left out on the patient education from the doctor or what they can find online. Some important studies to note here are the PROWL-1 and PROWL-2 studies. This is the patient-reported outcome with LASIK. Now, the reason why this is so important is previous studies maybe were surveying and researching what the outcomes reported by the surgeons. The surgeons saying, hey, yeah, we had this many patients with dry eyes, with glare, problems like this. This study went back 20 years and directly went to the patients to have the patients report it. And so this is where these numbers are coming from. Some interesting findings from those: 28% of the patients reported not having dry eyes before LASIK, and now they do have dry eyes, kind of a chronic dry eye after LASIK. And also, depending on what research you're looking at, it can range between 8 and 48% of patients still reporting dry eye symptoms up to 6 months to a year after LASIK. And so the doctor lie or maybe not enough information given to the patients here with that, yeah, this would be a temporary dryness and it should get better. Whereas in fact, it can be 1 in 10 patients might have a chronic dry eye issue that needs to be managed. The second possible side effect that doesn't really get mentioned very much, and this is something that is very serious and can be very painful, and this is something called corneal neuralgia or corneal neuropathic pain. Now, I mentioned briefly that the process of LASIK does cut and damage the corneal nerves, but there are some people where those nerves don't regrow back, they don't heal up, and instead of what you might think happen to nerves where they just dry up and shrivel off and they just die off, a lot of times they can just misfire all the time and it will cause intense pain, jabbing pain into the eye. And I'm nervous at this part of the video because I really don't want to downplay the symptoms and the pain that people suffer from this type of corneal neuralgia. It can be very severe. In fact, when you hear of a tragic story of someone taking their life after having LASIK, it's likely from this type of side effect. Now, in the year 2025, the British Journal of Ophthalmology found the incidence of corneal neuralgia to be possibly upwards of 10.5% after LASIK, which is way higher than I initially thought. In fact, that's probably what the majority of people thought. Previously, it was more of an anecdotal type of evidence or anecdotal type of side effect where people experience this corneal neuralgia, and that was likely because we didn't have the tools or the technology to really test for it. Now we have confocal microscopy that can measure the corneal density in the nerve to show that it's actually low and damaged for many years after LASIK. Now the big issue here is because there is possibly that mindset that this is such a low incidence rate that a lot of doctors mostly previously would just kind of slough this side effect off as being a dry eye issue, saying, hey, you probably should use more dry eye drops, or maybe doing a dry eye drop medication, where those dry eye drops don't really help this corneal nerve problem. And these are generally the people that I see online, even if it is just a few of them saying, hey, I really had a bad outcome with my LASIK. I am in a lot of pain, or I've had to go to the hospital multiple times. I'm on all these pain medications. There has been nothing that has helped. They are trying to bring awareness to the possible side effect. Even if the side effect is low, a lot of these people do not feel heard. So are eye doctors lying or deceiving or maybe suppressing data to their patients? One possible thing that might be happening is something called optimism bias, where that surgeon or eye doctor that did the procedure sees 95% of those patients that do have high satisfaction. They loved LASIK. And so the doctor sees all those patients and says, hey, yeah, this is amazing. But maybe that smaller percentage of patients that have continuous side effects don't keep coming back to the surgeon or the eye doctor. Maybe they're going somewhere else, looking for any type of help from this doctor or this eye doctor or this eye doctor, trying to find relief somewhere. And so there is some of that optimism bias. And so a doctor will tell a new patient, hey, I've only had nothing but great results, to the next patient. Or at the very least, they don't put any more emphasis or weight on the possible side effects that might happen. That being said, there are some videos on YouTube, TikTok, where I have seen eye doctors that do brush off the side effects, or sometimes even say, hey, that is not true when it comes to dryness or neuropathic pain, saying, hey, no, this does not happen with LASIK, and it is a little bit cringy. And so I'm hoping that I can at least shed some light a little bit on the issue, but yeah, some people do need to be heard about their side effects. So I think as eye doctors, we have a lot of improving to do, a lot of improving of how we can properly educate our patients. I know that I'm trying to improve and provide as much information as possible if someone is looking into LASIK. Outcomes, statistics, side effects, possible long-term side effects, and other alternatives to LASIK. And I'm hoping that I can provide as much as possible so they can make the right decision for them. But if you want to learn more, I'll provide links to some of the research and other articles in the description if you want to check that out. Or you can check out my playlist where I kind of go more into some details about LASIK and what to expect. I hope this helped. If you have any comments, questions, or experiences with LASIK, leave them in the comments. Stay focused.